Hello everyone, and welcome to my final project presentation. For my project, I'm going to focus on the physical changes throughout each stages of adulthood and how common health problems such as obesity and diabetes affect adults' cognitive and social development. Hello everyone, and welcome to my final project presentation. For my project, I'm going to focus on the physical changes throughout each stages of adulthood and how common health problems such as obesity and diabetes affect adults' cognitive and social-emotional development. Adulthood is broken down into three life stages, which are early, middle, and late adulthood, and each adult stages is characterized by age, defining features, changes, and challenges. Early adulthood, or often known as emerging adulthood, is the transition from adolescence to adulthood and occurs from approximately 18 to 29 years old. Early adulthood is a time of experimentation and exploration. Markers that indicate an adolescent has matured into an adult are accepting self-responsibility, making independent decisions, becoming financially independent, and developing emotional control. During this stage, adults are both at their peak of physical performance and at the start of physical decline. Several physical changes experienced by early adults include decreased muscle tone, strength, saggy chins, increased fatty tissue or protruding abdomen, decreased visual strength and adaptability. A common issue among early adults is that early adults may know how to prevent illness but do not apply the practices and develop bad lifestyle habits. As a result, common health problems are obesity, diabetes, and high blood pressure. Middle adulthood is often described as a developmental period involving physical performance decline, responsibility expansion, and life reassessment. This stage in life occurs from approximately 40 years old and extends to approximately 60 years old. During this period, adults focus on balancing work and relationships and instilling life lessons onto the younger generations while experiencing physical and psychological changes associated with aging. Also, middle adults start to experience increase in stress due to increase in responsibilities both at home and at work. Some physical changes during middle adulthood are wrinkled skin, gray hair, age spot skin pigmentation, saggy muscles, progressive bone loss, and also visual and hearing loss. With increased responsibility, many middle-aged adults struggle to meet the national daily physical activity requirement of 30 minutes of moderate to vigorous aerobic physical activity, thus increasing likelihood of obesity and cardiovascular disease. Common health problems in middle adults are high blood pressure, high cholesterol, obesity, and diabetes. Late adulthood is the last stage of adulthood, and physical changes that occur in late adulthood are visual and hearing impaired, among other physical changes. During this late adulthood period, late adults reflect and self-evaluate on their life and prepare for the future. Physical changes in late adulthood include wrinkles, age spots, shortened height, saggy-looking body, muscular and brain atrophy. Common health problems are cardiovascular disease, diabetes, obesity, arthritis, and osteoporosis. Although atrophy is inevitable, older adults can delay the onset of health problems and chronic diseases by participating in daily light to moderate physical activity. With daily exercises, late adults can also increase their longevity. According to the CDC database, in early adults, cardiovascular disease is among the top 5 leading causes of death, with accident and unintentional injuries, homicide, and suicide being the top 3. However, in middle adulthood, the frequency of accidents and injuries decline, and so the leading causes of death in middle adulthood are cancer, followed by cardiovascular disease. In late adulthood, the leading cause of death switches, number 1 being cardiovascular disease, followed by cancer. Obesity and diabetes are 2 serious chronic diseases that negatively affect adults' quality of life and longevity. Obesity is a complex health problem because it is caused by a combination of inherited genetic, environmental, and behavioral factors rather than only physical activity and poor diet. Obesity is a chronic relapsing neurobehavioral disease that is associated with having excess amount of body fat or high body mass index or BMI. Obesity is described as a neurobehavioral disease because obese adults experience impaired metabolic pathways along with disordered signaling for hunger, fullness, and satisfaction. Obesity can also be caused due to environmental factors, behavioral factors, and genetic factors. Prevalence in obesity among adults in America make up approximately 40%. Among all obese adults in America, among all early adults, approximately 40% are affected with obesity. Among all middle-aged adults, approximately 45% are affected. And among all older adults, approximately 43% are affected. Obesity can lead to increased risk of chronic diseases and mortality. Diabetes is a chronic disease that affects how the body turns food into blood glucose, which is the body's main source of energy. A buildup of too much blood glucose can cause damages to the blood vessels throughout the body and the brain due to blood clotting, and can lead to serious health problems such as cardiovascular disease, stroke, and kidney disease. There are 2 types of diabetes. Type 2 is characterized as insulin resistance, insufficient production of, and inefficient use of insulin. Type 1 diabetes is characterized by absolute lack of insulin due to the body's immune system destroying insulin-producing beta cells of the pancreas. The most common type of diabetes is type 2 diabetes. Type 2 diabetes is caused by inherited genes, environmental factors such as inaccessibility to healthy food, and lifestyle factors. Usually, type 2 diabetes is developed due to physical inactivity and obesity, whereas type 1 diabetes is usually caused by genetic or environmental factors such as a virus. Diabetes is the 7th leading cause of death among adults in the U.S. Adults affected by diabetes make up approximately 10% of total adults in America. Among all early and middle-aged adults, 13% are affected with diabetes. Among all older adults, approximately 27% are affected with diabetes. Diabetes is a major contributor to leg amputation and cardiovascular disease. Approximately 68% of all diabetic adults die from cardiovascular disease. Although type 2 is treatable and preventable, type 1 diabetes, there's currently no cure or preventative measure. So now, how does obesity and diabetes affect adults' cognitive and social-emotional development? In regards to cognitive development, Obesity and diabetes cause hypertension and damage blood vessels through blood clotting throughout the entire body, including the brain. This lack of oxygenated blood and nutrients to the brain causes the brain cells to die and impedes cognitive development. Obesity and diabetes can also increase the risk for vascular dementia and early onset of Alzheimer's disease. In regards to social-emotional development, obesity and diabetes can disrupt daily life due to developed physical limitations. Adults affected by diabetes and obesity may suffer from low self-esteem and self-image and social isolation when among and/or compared to healthy peers, which can later develop depression or depression symptoms such as rejection sensibility. Furthermore, diabetes and obesity affect social emotional development in adults because treatments for diabetes and obesity are expensive and can place financial burden and relationship strain on families. Out of all the theories to explain development, or out of all the different types of biological theories of aging, such as evolutionary, cellular clock, free radical, mitochondrial, and hormonal stress theory, I chose the hormonal stress theory to best fit the explanation for aging. Hormonal stress theory argues that the body responds to stress by releasing hormones and that the aging body hormonal system has lower resistance to stress, which increases the likelihood of disease. As adults age, adults' level of stress increases along with their responsibility, but their tolerance for high stress decreases. This decrease in tolerance for stress causes adults to be more susceptible to diseases and chronic illness. Gray hair is also an indication of age and stereotypically a hormonal response to stress. Therefore, I believe the hormonal stress theory provides the best explanation because stereotypically, our body responds to high levels of stress by producing gray hair, which is also a physical change associated with aging. Therefore, if adults' ability to manage stress decreases while the rate of gray hair production increases with age, then the human body's hormonal response to stress is linked with aging. Now, why did I choose this topic of obesity and diabetes and how they affect cognitive, social, emotional, and physical development in adults? Because my job is a physical therapist technician, and while working at a physical therapy clinic, I have noticed that these diseases are common sources of physical ailments such as partial paralysis, joint pains, primarily in the lower extremity, especially in the knees and the ankle, limited mobility, and limited range of motion. With this information I have learned on this topic, along with the chapter readings associated with the physical, cognitive, and social-emotional development from earlier to late adulthood, I hope to use this knowledge to not only better to treat and motivate my patients in the future as a physical therapist, but also to better assist both my parents and grandparents at home as a house expert. Thank you for watching my project presentation, and good luck with everybody in the final.